We are also fortunate to have one of our AARP health experts, Nora Super, with us today. Nora is the Director of Federal Governmental Relations, Health, and Long-Term Care at AARP. In this role, she is responsible for managing AARP's lobbying and governmental relations activities regarding health care reform, Medicare, Medicaid, long-term care, and prescription drugs. And I might add that she carried a copy of the bill on the plane with her today and has been carrying it around for literally weeks and weeks. So,
did you hurt yourself?
And prior to coming to AARP, Nora served as Kaiser Permanente's Director of Public Policy and Governmental Relations. Nora has more than 20 years of experience working in Washington, D.C. with an impressive background in a wide range of health policy issues, including Medicare, Medicaid, HIPAA, ERISA, and other federal and state health programs. A native of New Orleans, Nora studied political science at Tulane University and did her master's work in public administration with a concentration in health policy at George Washington University. And clearly, she's from the Southeast. We'll call New Orleans Southeast today. From our AARP Georgia State leadership, we have Cass Robinson, our AARP Georgia State president. And Cass, where are we? Cass, you say it. Thank you. Cass is a lifelong public servant. He has made a professional and volunteer career of deliberating and advocating public policies in Georgia and Washington, D.C. He was first elected to the Georgia General Assembly in 1976, where he served 11 years as Representative Committee Chairman and floor leader of the powerful DeKalb County House delegation. He was appointed by the governor and later elected to the Georgia Public Service Commission. Cass has served the Presbyterian Church for 20 years as a pastor and a denominational executive for the Presbyterian Church U.S. Board of National Mission. He received a bachelor's degree from the University of Alabama. I don't know how that slipped in there. A master's degree in divinity from Louisville Presbyterian Seminary and completed advanced graduate studies at Austin Presbyterian Seminary. Last but not least, our moderator for today, Art Terrell. Good. And he does this very smoothly. Art Terrell is well known for his smooth voice and captivating personality. An Atlanta native, Art Terrell embraces the successful expansion of urban community radio music within the greater Atlanta area. Art Terrell is the host for KISS 104.1 WALR-FM Afternoon Drive, where he provides listeners with an entertainment, news, and a little comic relief, an excellent mix of music every afternoon for their drive home from 3 to 7. Art Terrell has also produced music and studio commercials for the music industry's top artists. We appreciate Art Terrell for sharing his time and talents with us today. Now, may we please join me in welcoming to the stage Dr. Joyce Payne for her remarks from the AARP board.
Thank you so much, Ken. My mother would have been pleased to hear that introduction, and very comprehensive. And I'm so glad to have all of you in the audience in spite of the weather today. This is an extremely important time for us to have this discussion. I was saying to one of our participants here today that we lost some individuals this morning because of the rain. But there's a storm out there brewing, and so we need to tolerate the rain so that we can come together and have this discussion. I must admit also, Art, that I've had this vicarious love affair with your voice, and so now that I've met you, maybe we can continue the conversation. I am so pleased to be here as a volunteer at AARP, and I met some of our volunteers last night, and Cass, our great state president, and I have to say to you that you really are doing God's work out there. I'm a super volunteer. Someone asked me, well, you know, what do you get for being on the AARP board? And I said, you get a lot of reward, but lately you get a lot of grief too. But that's fine. I'm a child of the civil rights movement, and as long as there are no dogs in the audience, I can tolerate the human ones. I'd like to sort of stick with the script, because what's most important today is to hear from you and to have some dialogue about what's on your mind. We are a 40 million member organization, and so we are extremely concerned about hearing your voice, about taking your concerns back to our policymakers so that we can do the work on your behalf. I want to also thank, of course, Representative Scott for being here with his exceptional staff and for taking part in this important discussion. Today, the battle over health care reform is intense, as all of us know. And AARP, rightly so, is a part of that battle because we believe now is the time to get reform done for the people of the state of Georgia and for the nation. Look at the situation in your state. According to most recent calculations, Georgia has the 10th highest uninsured rate in the country, with almost 18% lacking health insurance. Nearly 270,000 Georgia residents ages 50 to 64 are uninsured, and many more are underinsured. About 123,000 people fell into that notorious donut hole and had to pay full price for the prescription drug costs. AARP is in the fight for health care reform to make sure your voices are heard. We have listened to you, and you've made it very clear. You want us to fix what's wrong while preserving what's right, to preserve what's working for so many Americans today. That's why we're working with the administration. We're working with Congress. We're working with Republicans, with Democrats. I always tell people we don't have any permanent friends or permanent enemies. We have permanent issues. We want to create a health care legislation, or create health care legislation that will above all guarantee you a choice of dependable, affordable health insurance, along with a doctor you can count on who will work with you to make the best possible treatment choices. Let me make it very clear that we have not yet endorsed any health care reform or proposal, period, unequivocally. We, AARP, have not endorsed any health care reform legislation. We are committed to making sure health care reform will strengthen and improve Medicare by closing the Medicare Part D donut hole, ensuring patients access to doctors they choose, and eliminating substantial fraud and abuse. In fact, we're strongly committed to making sure all Americans can choose their doctor, their health insurance plan, and where they receive their care. We also are strongly committed to ending discrimination by insurance companies by preventing them from denying you coverage because of a pre-existing condition or forcing Americans 50 to 64 to pay unaffordable premiums just because of their age. And we are strongly committed to ensuring that all Americans have the security of knowing that if you lose or change your job, they will be able to afford quality health insurance. Now there are special interest groups, as you know, out there trying to block progress on health care reform by grossly distorting the facts. As a matter of fact, I was telling some of the volunteers last night, I was trying to jog at the Y, and I had my AARP shirt on, and matter of fact, I may rethink that in the future, but anyway, I had my AARP shirt on, and a gentleman next to me who was older than me said, you know, you belong to AARP, what do you do there? And I told him, and he said, I don't want any of my money being spent on abortions. And I said, sir, that's great, but I don't think the two of us need to be concerned about that. And especially, he doesn't need to be concerned about that. But anyway, he went on to talk about abortions, and I promised him before I left that I would never have another abortion. But, but in spite of that, you know, I wanted to have somewhat of a rational discussion about the real issues. And unfortunately, we didn't get very far. But the one thing he taught me is be careful where I wear my shirt. Like the notion that health care reform would ration your care, hurt Medicare, or government takeover. All myths, all distortions. These statements are simply not true. And that's the most polite term I can think of right now. I'd rather call it something else, but AARP has held me to the script. Perhaps the most disgraceful is the myth that health care reform will somehow give the government the power to make life or death decisions about us and our family members. The simple truth is, every health care plan currently being debated in Congress would ensure that you and your doctor will continue to make decisions about your health, period, unequivocally. Under any health reform plan AARP will support, the majority of working Americans will continue to receive their health care through their employer.